Time for a look at this week's health headlines. All that texting, scrolling, and swiping on our smartphones is leading to some health problems. According to the Mayo Clinic, there are more reports than ever of soreness or numbness in hands, and experts say it links back to that phone. If you use your phone more than 5 hours a day, you could be at risk of problems like carpal tunnel, tendinitis, and arthritis. A new study shows that people who eat lots of fruit and vegetables have a reduced risk of some chronic diseases and conditions like heart disease, diabetes, and certain cancers. Here's some tips on how to get more of the good stuff into your diet. Eat mostly whole or cut up fruit to get the beneficial fiber it contains. Buy fruit in season when it's most flavorful and least expensive, and keep it in a bowl in clear view so you'll be reminded to eat it. And finally, good news for coffee lovers. According to 2 new studies, drinking more coffee could lead to a longer life. One study, the largest to date on coffee and mortality, found increasing coffee consumption could significantly lower a person's risk of early death. The second study found that people who drank 2 to 4 cups a day had an 18% lower risk of death compared with people who did not drink coffee. Part of what makes community medical centers so special is the staff. Each week we feature a healthcare hero, someone who demonstrates what it's like to go above and beyond for each patient every day. This week, we meet Lisa Knoll. She's a care coordinator at Community's Behavioral Health Center. She does case management for patients, talking to families throughout the process, and essentially is there to make sure each patient gets the legal and mental help they need and deserve. She says while her job can be complicated, mental health is a passion she's always felt drawn to.
I've had this interest in mental health, more the psychotic aspect of it, the schizophrenics, people who are bipolar, and so it's very interesting when you get to work with them, how far off baseline they can get, but how closely they can come back. So it's very interesting. And it's neat because you're kind of a part of this journey, like good or bad.
Knoll says one of her best days involved a patient who had been at the facility for 26 days and arrived catatonic. Finally pulled out of it. She says that patient has been living a healthier life ever since, all thanks to the hard work and caring of Knoll and her team. If you'd like to join the team at community medical centers, there are jobs available right now, including this one, Utilization Review Coordinator. You'll need an education background, an associate's degree in nursing, and it's preferred to also have a bachelor's degree in nursing. If you have 2 years experience as a registered nurse with experience in discharge planning, case management, or utilization management, even better. To see the full list of requirements and to apply for this job, head to jobs.communitymedical.org. Still ahead on Medwatch today, a longtime golfer nearly loses his leg, but thanks to community doctors, he didn't lose everything. Hear his story after this. And we'll head into the kitchen for something you'll want to head out to the grill to try yourself. Sweet and savory paired perfectly as Medwatch today continues.